Hi, I want to talk to you about type 2 diabetes. Now, type 2 diabetes is obviously a serious health condition and probably not what people want to hear on a Friday afternoon or over the weekend. But on Tuesday, the 11th of June, I'm doing a webinar on type 2 diabetes. So I just wanted to give a bit of an introduction about why we need to be considering this a bit more seriously than I think I see people doing. So in my work, I'm all about prevention. But I see a lot of people who still have quite a blasé attitude to things like type 2 diabetes. So it has become normalized and it is extremely common, and that makes it even more normalized. But what I want to stress is type 2 diabetes is not okay. It is not okay. It's not a good place to be. It's not a nice disease. It's a serious disease. It's considered a chronic disease. And just because it's become normal and just because it's commonplace, it isn't okay. And so I want to stress the importance of that. And one of the big ways of stressing the importance of that is to show you that type 2 diabetes will actually decrease the life expectancy of a person by up to 10 years. So that should be, often isn't, but it should be some motivation for people to think, oh, and to make some preventable and modifiable, lifestyle changes. But unfortunately, that doesn't seem to hit home. So I want to go through a bit more a bit later on. It is estimated that 1 in 11 adults globally have type 2 diabetes. And we actually have a lot of people who are undiagnosed as well. So these are the figures of people who we know have it. If you consider if you're pre-diabetic or if you've had that conversation about blood sugar with a GP, there's lots of people like you who haven't had an official diagnosis but are at considerable risk. And they're the type of people that I want to talk to right now. So it's a horrible disease, okay? It's normalized, it's common, but it's not pleasant. In the UK alone, there's 135 amputations a week from type 2 diabetes. Now, type 2 diabetes has comorbidities, complications of disease, or friends of diseases, as I call comorbidities. And with type 2 diabetes and amputations, it is still common. It is not something that used to happen and it's gone away with medication. It is still common. 135 amputations a week in the UK from type 2 diabetes. And type 2 diabetes is also the leading cause of preventable sight loss in the UK. In terms of heart disease, I posted in my A to Z of health under heart disease the increased risk of type 2 diabetes with both heart disease and dementia. But just again, every week in the UK, 530 heart attacks and 680 strokes in the UK as a complication of type 2 diabetes. And also I did another blog on my A to Z on kidney disease and type 2 diabetics, more than 5 times more likely to get kidney dialysis or need a kidney transplant. So if they don't make people think, what is my modifier, what can I change, what can I do, then I don't really know what will. So what are the financial implications of this? It's a largely preventable, lifestyle-led disease, but somebody has to pick up the pieces. We have in the UK an amazing NHS, but that often makes us take less ownership for our own health because somebody's always there to pick the pieces up and we don't have to pay for that. So what does type 2 diabetes cost our healthcare system, and how is our NHS meant to cope with this? So it costs £1.5 million per hour to the NHS. That's £25,000 a minute on type 2 diabetes. That's £14 billion a year. And this is only on diabetes, not the complications, not the comorbidities that come with it. So currently it's 10% of the NHS total budget, which we know is humongous, but 10% of it is going to type 2 diabetes. Prevention, 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 prevention. I cannot stress enough. This is a horrible disease and it's largely preventable, often reversible. You cannot escape the fact diet and lifestyle are intrinsically linked to the development and progression of this disease, and not just for you. And this is, I don't want to sound scary, but not just for you, but for future generations as well. Your heritable information that you pass on to your unborn child contains information about type 2 diabetes. It will shape their future. Of course, they can live an amazingly healthy lifestyle and escape that genetic imprint link, but it's not the best thing to be giving them. So it makes future generations of children at risk of type 2 diabetes as well. And if you have a parent, or if you are a parent with type 2 diabetes, you are passing on a risk to your child. 15% if it's one parent, 75% if it is both parents. If both parents have type 2 diabetes, your child or children is 75% more likely to also get it. I need to stress this is preventable. I need to stress I can support people. I'm qualified in nutrition and diabetes, and I can support. This is a serious condition. This is a preventable condition, and this has a huge impact. We cannot just pretend it's not happening. It is happening. Financially, it's a burden. Financially, it is potentially going to cripple the NHS, and it is a healthcare ticking time bomb. And it is a nasty disease. I can't stress enough how it is a nasty disease. So I am putting on a webinar, 11th of June, 7:30 p.m. You don't need to be there. You can sign up and then get the recording. So if you're not around at 7:30, don't worry. In there, I have handouts on support information, as well as going through the preventable, the modifiable. Yes, of course, you can go and Google, but I make it much more concise for you, and I am qualified. Google isn't. So I am qualified to support you to make those changes, to start to make those fundamental changes for future health, life expectancy decreased, all manner of comorbidities, and a family link to be passing on for future generations. Please check out my webinar if you have concerns about yourself or a family member when it comes to type 2 diabetes. It is normal, it is common, but it's not okay. So I hope to see you. The information is on my website for the webinar. It is only £10. I would like to see you there to help you to implement some changes for a healthier future. See you then.